Buenos días y gracias para esta oportunidad para hablar con ustedes el día de hoy. Soy asambleísta, Dr Joaquin Arambula, y trabajo duro para nuestras comunidades de campesinas y trabajadores en el Capitolio de Estado. Antes de ser político, trabajo como un doctor para 10 años en una sala de emergencia y empezó este día en español para dar respeto a nuestras comunidades. I always like to begin in Spanish to make sure I'm giving proper respect for the communities that I have the honor of representing in our state capital. I am Assemblymember Dr. Joaquin Arambula and have been elected since 2016 to serve in our state assembly. Prior to being elected, I worked as an emergency room doctor for 10 years in Selma, which is the raisin capital of the world, where I saw firsthand many of our community members who were unable to access health care other than coming to see me in the emergency department. And I saw an injustice that happens when far too many of our community members have their lives impacted and shortened because of that inability to access health care. So I decided to ask something more of myself and to run for office, and have been happy that my community has supported me for the last 8 years. And in that time in the legislature, I've served for the last 7 years as the chair of the Budget Subcommittee number 1 on Health and Human Services, which oversees every dollar that our state spends into health care and human services. It's in that capacity that we've been able to significantly bolster those resources for health and human services, which has supported our Medi-Cal population, our Department of Public Health, CalWorks, SSI, and the developmental disability community. It's important for us to make sure that our social safety net is competent and able to handle our community members' needs, and that it has the resources necessary to make sure that we're providing the appropriate supports. And so I'm going to talk to you a little bit about the previous legislation I've carried, as well as legislation that I'm working on this year. And so I'll begin with Assembly Bill 447, which was chaptered into law last year after being signed by the governor. This law is the Inclusive Higher Education Act and works with our four-year universities, similar to how they have worked with the Redwood Seed Scholars Program at UC Davis and the Wayfinder program at Fresno State, that they can provide supportive services and an inclusive environment to provide independent supports, as well as internships and employment opportunities to those who are wishing to go to higher education institutions. I am pleased that this legislation is now the law of the land and would encourage more higher education institutions to learn from those that are successfully creating spaces to be more inclusive, so that we can provide those learning opportunities, the chance for self-determination, and ultimately for independence for our disability community. These types of supports are so desperately needed in our higher education institutions, not only for our disability community, but more broadly for all of the students who are attending, and for them to be around and supported, and to see our disability community in the same spaces while they're seeking educational attainment. I'll next move on to the bill that we've introduced this year in support and sponsored by the Association of Regional Centers. I'm really pleased that we're working collaboratively to figure out how to provide better dental care for our disability community. We all know that unfortunately there are oftentimes long wait lists for our communities to be able to be seen, or needing to go through general anesthesia and sedation as a practice, rather than supporting our community and providing the preventative screens that we know are so desperately needed. Dental care is health care, and making sure that we have proper oral care ensures that our community helps to prevent diseases and live healthier and better lives. And so we're working to figure out how to desensitize much of the experience for our disability community. How do we expose them to what it's like to go to an office, to sit in the dental chair? Can we have them meet the staff and the dental hygienist who will be working on them prior to it? The goal is ultimately to improve the health and dental outcomes for our disability community. This piece of legislation will allow us to get upstream and to perform more preventative care. And again, would just encourage you to work with my office to make sure that we can get this bill signed into law. The goal will ultimately be to expand this to more regional centers so we can increase the capacity of training for more of our disability community to recognize and realize these benefits. It's also important for us to make sure that we're providing in a culturally competent way compassionate care for all members who are seeking access to services. I believe it's important for us to meet people where they're at, which is why I've introduced legislation such as Assembly Bill 2080 and 2110. 2080 is to make sure that the providers of care, that the physicians, the medical doctors, are reflective and concordant with the communities that they serve. Having practiced medicine for 10 years, I know the importance that it has when you're able to break down people's barriers and build trust and establish that cultural competency through a shared lived experience that really empowers the provider to better be able to make sure that we're communicating effectively. Assembly Bill 2080 will allow us to make sure that we're moving in that direction by focusing on the admissions that we have for our medical schools so that they can be more concordant with community. Assembly Bill 2110 focuses on our need to make sure that our community health workers and our doulas, who are trusted messengers and culturally competent, are able to perform ACEs screenings, the adverse childhood experience screenings that are available through Medi-Cal from the EPSDT are a very important way for us to identify trauma that has occurred in our communities and those who need supports and resiliency the most. By expanding access to our CHWs and doulas, we're making sure that those trusted messengers who are on the front lines are able to provide the culturally competent care that we need. Now, none of these bills can get signed into law unless we're wanting to make the change that we want to see in this world. And so I want to energize you and encourage you to take part in this process and to make sure that we're working collaboratively together. It's in spaces like this, at summits like you're at today, where we're able to get together with like-minded individuals and to share how we can work collaboratively to make that change that we know needs to happen. And so I'm excited to be with you here today to share some thoughts and look forward to the battles that we have ahead. Thank you for allowing me to share some words with you, and have a great summit.